Hi everyone, this is Arshdeep. In today's podcast, we'll be discussing about the separation anxiety, which comes under the psychosocial lens, which examines person's mental health and how it influences their behavior, and a likewise example of a 3-year-old Jack who suffers from the separation anxiety and is being parented by a single mother and a twin sister suffering from the same condition. They falls under middle socioeconomic status. Jack, who was born in Ethiopia, specialized in strong gross motor skills. He is struggling with this disorder from some months, and still some strategies are being used to make him feel secure in the classroom environment. Separation anxiety disorder is a specific kind of mental health issue. Sometimes a traumatic event is responsible for causing this disorder. A child who suffers from separation anxiety disorder or SAD worries a lot about being apart from their family or other important individuals. The child fears being separated from their family or that something horrible will happen to a family member if they are not present. The most common signs of separation anxiety disorder or SAD are worrying about the safety of a family member, muscle aches, panicking, refusing to sleep alone, being very clingy, having tantrums at times of separation from parents, etc. The information gathered from Stanford Medicine Children's Health 2019. There are some ways in which separation anxiety affects children's learning. This includes refusing to go to school, disruptive or reckless behavior, not responding in class, or trouble answering the questions, developing problems in certain subjects, leading to learning disorder, avoiding teamwork or group work because they are afraid of getting being judged, etc. According to information from AHMAC 2016. Moreover, learners like Jack, when separated from their parents, experiences some physical symptoms like headaches or stomach aches. The youngster is extremely distressed by their dread of separation, which could prevent them from engaging in regular activities like playing with other kids. The information from separation anxiety disorder in children. Some future impacts of separation anxiety on learners would involve poor academic performance, where children will struggle with focus and concentration in studies, achieving low grades, and in higher possible scenarios, school dropouts. Even if separation anxiety disorder is left untreated, children may also develop social anxiety disorder, obsessive compulsive disorder, OCD, or some phobias. Along with it, they will suffer social isolations where it would be difficult for them to make friendships with others. Furthermore, this dysfunction in adulthood can potentially result in other mental health conditions. The information gathered from Patel and Bryant 2021. Anxiety is also responsible for causing some health neurological problems and other illnesses which impacts the body and affects the quality of life of the person, according to the information from W. Panjine 2018. There are some teaching strategies and other ways which involves cognitive behavioral therapy or CPT, family therapy, to prevent separation anxiety in children. This includes by acknowledging students' feelings, by comforting and making them feel secure, by creating warm and welcoming environment, by offering children choices over play. This will help them build good relations with other peers, by communicating with parents about the child's progress, their routine, involving one-on-one interaction, etc. The information gathered from Groening 2021. One can also consider some little tales describing some stories where mummy departs and always returns back, or some patient setting strategies to calm down students. Other additional support, if these teaching strategies are not being used, involves seeking help from some child's pediatrician, and the pediatrician, after examining, will direct if a child needs to go to a therapist or psychologist. Thank you for staying connected with us and for listening this entire podcast.